Hi, I'm Sandy Summick, and I have the great pleasure of doing 2 courses for C&E. And the first one is ECG rhythms, and the second one is the 12-lead ECGs.
To become a cardiovascular technologist, we have to take an ECG course through correspondence, and I took them to supplement the correspondence course. In the cath lab, we're monitoring patients all the time while they're on the table, and it helped me to recognize different rhythms that I need to alert the doctor to right away.
Okay, there's always the big basic question about why we should be taking these courses. First of all, the rhythms, the leads 1 and 2. When we're monitoring our patients, either in our critical care settings, as we have seen Heather, in our cardiac cath lab, we need to know our rhythms as well. And what we find is that the more you practice, the more you know, you're able to respond to what's going on in the patient's rhythm, so you can accurately treat them and feel comfortable about it and act appropriately. What's also interesting when I get to teach different nurses is that I learn an awful lot as well. When I interact with rural nurses, I find out, a lot of the questions that you have that aren't being addressed, and it's kind of neat that, sometimes we can come up with solutions for some of your problems, or if I'm having problems in the city that we can figure out together, and then we get back together later and come up with answers that each of us never had before.
Absolutely, both the rhythm strip and the 12-lead helped me a lot. I would recommend it to anybody to take them.